session this morning on robotics, and we were having a telephone call, conference call on this session. Several people made the connection between robotics and 3D printing. There isn't a necessary connection. You can do a robot without 3D printing. You can do 3D printing without robots. Where's the intersection of that opportunity of robotics and 3D printing?
Well, that's a field that's just evolving. You know, a couple of years ago, there was a company that got a lot of attention from doing what looks like a simple thing, but it's a big step. And what they did, they got a silicone sheet, made an incision as if it's skin, they cut in a skin, and then allowed the robot to make the way to the suturing without somebody moving the robot. So that tells you that really there's a lot that can be done. The robot, as it is now, can't understand where it is in 3D in space. So if you can add some synchronization or image registration to these 3D organs that you're printing, then we're talking about a different dimension of applications.
Yeah, and so Jacques, I wonder how much you see an opportunity to sell units into hospitals as opposed to providing a service to manufacturers, precisely to help them, create implants. Certainly, when you read the popular press, when people talk about 3D printing, it's almost always in the form of this surgeon ran into a patient who had a very tortuous anatomy, and he or she 3D printed an implant. So where do you see that as a potential business model?
Yeah, I think that business model is proving effective, and there are a lot of players in that field. So my company is a startup. We moved out of my kitchen 2 years ago, shortly after I developed the technology that lets us manufacture these. We have 4 employees now, and we're looking to raise our first round of capital. What that means is that I do not want to go into a space where there's significant competitors, because they have a lot more resources, they have a lot more engineers, they're probably going to do a better job than my team would be able to do. What we have, though, is the power of a new technology that's opening up a whole new market of pre-surgical rehearsals and of models that are helping medical device companies really show off their technology. So that's what we are laser focused on, and the space that you're talking about is more mature, and there certainly are successful companies, I believe, and successful models in that space.
When we were